Hi, welcome to Swedish Medical Center Issaquah campus. I'm Lane Walsh, a family educator with Swedish's Birth and Family Education Department and a mother of 2 children born at Swedish. Having a baby is an exciting time for most families, but it can often feel overwhelming. We want you to feel as prepared as possible for your upcoming birth. Take a tour with me as we show you where to park and enter the hospital, how to get to labor and delivery, and what a birthing suite looks like. You will also learn about amenities and resources available to you and find out what you can expect when you arrive to have a happy birthday. When you think you are in labor, the first step is to call the clinic you go to for your prenatal care. Your doctor or midwife will contact the labor and delivery staff to let us know you are coming. This allows our medical team to prepare for your arrival. Park in the parking lot near the main entrance at 751 Northeast Blakely Drive. Enter the hospital and take the stairs or elevator to the 2nd floor and look for the labor and delivery sign. When you arrive at the entrance to labor and delivery, there will be a red buzzer on the wall outside. You will need to press this buzzer for entry. The staff will be expecting you. OB triage is the first stop for most families. This is the area where you and your baby will be evaluated to see if you are ready to be admitted into the hospital. Our team will assess the progress of your labor and monitor your baby using an electronic fetal monitor. This information gives us a good idea of how your baby is doing with labor. Let's go look at a birthing suite. When you are far enough along in labor to be admitted, it is usually time to find ways to cope with your contractions. We have many resources and tools available for you to use. Each of our spacious birthing suites has a jacuzzi soaking tub with jets, private bathroom with a sit-down shower, birthing peanut, rocking recliner chair, mirror, and a birthing bed that can be moved into different positions. A squatting bar can be attached if you would like one. At your request, we are happy to provide you with a birthing ball, birthing stool or cub, and hot or cold compresses. If you would like an epidural for your birth, an anesthesiologist is available 24 hours a day. If there is a need for cesarean birth, you will be taken to an operating room for the surgery. As long as you are awake for your surgery, you may bring one support person in addition to your doula or an interpreter if needed into the operating room. Once you leave the operating room, you and your baby will be taken back to the birthing suite for about 2 hours to be monitored before you move to a postpartum room. If your baby is born full-term and medically stable, the baby will be placed immediately on your belly or chest, skin to skin, for the first hour after birth, or through the first feeding. The first feeding usually happens 30 to 60 minutes after delivery with the help of your nurse. Feeding your baby is an important skill for every new parent to learn. We have nurses and lactation consultants available to provide you with the support you need. You can plan on having your baby with you during your entire hospital stay. This is called rooming in. If your baby is born preterm or has other medical issues, the medical team from our Level 2 Special Care Nursery will attend your delivery or be available to provide medical care once your baby arrives. In these situations, it is common for the baby to spend some time receiving care in the Special Care Nursery. Once you and your baby are medically stable, you will be taken to a postpartum room where you will spend the remainder of your hospital stay. Most families move to postpartum 2 to 3 hours after birth. You and your baby can plan to stay in the hospital 24 to 36 hours after a vaginal birth or 48 to 60 hours after a cesarean birth. Each postpartum room is equipped with a hospital bed, bassinet for the baby, and a fold-out bed for your support person. We encourage you to have one adult support person stay overnight with you in your room. It is recommended that you have your baby's medical provider picked before you arrive at the hospital in labor. We will be doing various health screening tests on your baby, and we will need to send the results of those screening tests to your baby's doctor. These tests include a hearing screening, metabolic screening, and a cardiac screening, which screens for newborn heart defects. It is Washington state law that if your baby is traveling in a vehicle, your baby must be in a car seat. We recommend that you practice installing the car seat before you arrive at the hospital in labor. Finally, let us tell you about a few resources that Swedish has to help you adjust to life as a new family. Birth and family education classes are important to help prepare you for childbirth, as well as for life after your baby arrives. Swedish doula services are available to give you emotional, physical, and informational support during your pregnancy, birth, and after your baby arrives. Comfort and Joy on the first floor rent breast pumps and sell up-to-date breastfeeding supplies, gifts, and more. If you have any questions or concerns about breastfeeding after you are home from the hospital, you can make an appointment to come back in with your baby to see a lactation consultant at Swedish Issaquah. The Lytle Center for Pregnancy and Newborns at Swedish First Hill is also available to you for additional services. Thank you for joining me on this tour of the Swedish Issaquah Birth Center. I hope you feel more informed about what to expect during your visit. For more information or to ask any further questions, please call 1-800-SWEDISH or go online to swedish.org. As a patient at any of our Swedish campuses, you have access to the best in personalized maternity support. We are here to help you and your family have the best birth experience possible. See you soon!